Hello, welcome to the Balance Mama Project Radio. We are your hosts. I'm Dr. Val, and this is Dr. Saiah.
Hey.
And we are here today to talk with you all about fertility. So we would like to note that we're not fertility experts. We are pelvic health experts. We're pelvic health PTs.
Yeah.
And we have a wide breadth of experience and education in addressing issues related to fertility. So we want to get into that today because not a lot of times do people think about fertility as it relates to pelvic health or physical therapy. Nobody really thinks about our profession, but we want to talk a little bit about that today. And then also with our conversation for the day, we will be talking about fertility as it relates to women for the purposes of this conversation. But of note, about 50% of cases, I should say, of infertility are male factor. And about 50% of cases of infertility are female factor. And so some percentage of that is a combination and some percentage of that is unexplained. But I say that to say there's still so much to be done as it relates to being tested for infertility, to being to recognizing what cases are out there of infertility. So we want to shed light on the topic today, and particularly as it relates to female factor fertility. So let's dive in. Pelvic PT. How can we help, Dr. Saiah?
So Dr. Val, even before we got on this chat, I know you mentioned that, or we were talking, and I think you put words to it perfectly when you said that pelvic PTs help create the optimal environment in the body for baby development. And so whether that's through exercise, whether that's through stress management, whether that's through soft tissue work, and we can do a deeper dive into these topics, those are things that we can help with. It's not just like, oh, let me get medication A, B, and C. I know I've seen a lot of women in practice where it's like, oh, I've had prior abdominal surgeries, or I've had prior struggles with pain with sex. And so there are many factors to get from point A when we are wanting a baby to get to point Z where tiny one is there. And even in practice, so even if something's common, it doesn't make it less emotionally stressful. So if you are listening to this and you have not heard our compilation of fertility experts who came on earlier, please go back and see. We did a March month for fertility and infertility, just for awareness from the psychological space, from the testing space, and had different specialists come on with us. So definitely check that out.
Absolutely.
And just for some facts on prevalence, before we do a dive in, I love the 50% because it's not just the ladies.
It's not.
It's not just us. But there's also some evidence that shows about 1 in 8 couples may have trouble getting pregnant or sustaining a pregnancy. And then even in this group, about 25% to 60%, yes, it's a wide range of individuals, are reporting some mental health symptoms that are coming with this. So whether that's anxiety, whether that's depression. And so, yes, mental component is also important. Check out Dr. Danny and our other podcast for it. Yeah. But today we're going to get into the physical.
Yeah.
So let's talk about exercise.
Yeah, so some of the ways that pelvic PTs can help are through exercise, through soft tissue mobilization, and through stress management. So exercise is one of the key things that we can do to help with fertility issues. And one of the theories behind that, right, is you're moving your body and you're getting increase in blood flow. And that's to all areas of the body. And so when we're moving, like even when we're walking, for example, our calf muscles are pumping the blood back up into our heart. All of our muscles are working to pump the blood back into our heart. And so we're increasing that blood flow throughout our body. So things like walking, Tai Chi, yoga, doing a little bit of ab work if there is some need to kind of do, well, I think we're both proponents of everyone doing core work, for sure.
You got to do your core work.
Because the core is the center of the body, and keeps you nice and upright and stable and all that. So bringing some blood flow into the area. And then also studies have shown that exercise can decrease cortisol levels and increase endorphins and increase oxytocin. So all of our really happy hormones and our energizing hormones, it's increasing. And all of our hormones that maybe lead to or are related to chronic stress, it's decreasing. So we really can focus on exercise and tailor that exercise to an individual's unique needs. Not everybody needs to be prescribed running a marathon. In fact, no. I wouldn't be prescribing that, right? But we're meeting people where they are. Maybe it's finding the gentle movement that you can incorporate throughout your day that allows your body to increase that blood flow, like we said, and decrease that stress, like we mentioned. So that's one way that PTs can help. And then also soft tissue, too.
Oh, girl, don't get me started on the soft tissue. No, I'm not a PT that's going to massage you for 60 minutes. That is not me. But I think there is so much value, especially like I've seen a lot of ladies, some ladies I've seen from prior to pregnancy, through pregnancy, into that postpartum space. But when we think about if folks have had hernia repairs, prior C-sections, prior for those who might have had endometriosis adhesions removed, all of these prior abdominal surgeries, when the body heals, a lot of times scar tissue is going to form. Am I saying we are going to get rid of all your scar tissue? No. Not that everything is disappearing, but where people are feeling restriction or feeling pain or feeling like the body isn't moving as well, a lot of times physical therapists can go in, or the pelvic PTs can go in, because yes, we're called pelvic PTs, but it's almost like abdominal pelvic PTs.
Right, exactly. And we also want to think about, like, even if you've had a back surgery, you have some adhesions in your back, that's also considered your core, right? So you're not a one-dimensional being. So we look at the whole 360 of the body, right? And so if you've had abdominal surgery, like back surgery, even top surgery, hip surgery, anything that's in the general region from, I would say, neck and shoulders down to the tops of the thighs. Yep. That's important information to know so that we can help with the adhesions. And I think you'll probably have to get right into the, why that's important. But
yes, I was going to say, when baby is growing, the same way people come into my office and like, oh, feels tight, feels restricted here. I'm like, tiny one has to grow somewhere. The uterus has to expand. We want to make as much freely moving space as possible. And so when we talk about, and even to your point of exercise is even typically targeted at getting the core moving, getting some gentle rotation in the area, just freeing up space. They say the baby's going to sit where there is space. And so even in that preparing for something new, instead of, oh, now I am indeed pregnant, let me try to free up some space so I won't be uncomfortable. Even beforehand is a great space to be like, let me make sure I'm optimizing what I have. And so posture can be nice and tall. And so we can feel strong in that before. And with that, not being plagued by the feeling of, oh, this tightness is restricting me here, probably will also take some stress off of your day. I know not being in pain is less stressful than being in pain.
Absolutely. When we think about chronic pain, addressing those issues, that's something that we are designed to help with, as musculoskeletal issues, and all of those things can contribute to the body feeling like it's prepared to carry a baby. And then speaking of stress.
Okay, I wanted to get stress. I'm sorry.
I
was going on another tangent with freeing up space.
Do the tangent. Go ahead.
For my folks who have pain with sex, if you plan to become pregnant through having sex, then do come see us nice and early. We would love to work with you, even if you're like, I'm not yet active. Oh, that's still a good chunk of my caseload. Would love to have you ready for motion before it's time to get active.
Yes.
And so that is definitely something we can help with as pelvic PTs, or I should say oftentimes something we can help with as pelvic PTs. If not, we'll send you over to someone else who might be more appropriate.
Yes, and that's even if you, let's say maybe you haven't gone down that realm in a long time of having intercourse, but you maybe still have difficulty or pain with putting in a tampon or things like that. Think about that as well. Gyne exams, exactly. Pain with that. come see us. Come see us, because we can help work on those pelvic floor muscles and help to decrease that stress and tension that's there too.
And so, for our final tidbit on stress, yes, we're keeping it short and sweet today, guys. We're hoping you'll do the deep dive with the experts and then come see us or sign up for a call for more info.
Yes.
So, yes, studies vary in results, but in some studies, higher cortisol levels, there was some correlation between that and fertility. So, cortisol is a stress hormone. It's not like, yes, cortisol is in the body. Yes, it has its helpful components, but high levels over a long period of time are not going to be as helpful. And so as PTs, often we do talk about, we'll talk about mind-body connection. And so, yes, there's a space for psychology. Yes, there's a space for mental health as a sole focus. But a lot of times stress can be also trapped in the body. So working with breathing, working with movement, even past traumatic experience. Sometimes it is the combination of working with the body and working with the mind. I tell my clients, you might want to do therapy at the same time, physical and mental therapy at the same time to start to address the stress. My therapist was like, you need to go ahead and do some yoga or Tai Chi. You have to release some of what's going on in the body.
Exactly. It's that releasing through movement. It's the releasing the physical tension, but also the tension that is stored up from emotional stress. We were just talking about this in our other podcast with Dr. Danny on fertility, but again, also just releasing some tension in the body really does keep the score per the book, and then also it really will hold tension and hold emotions because it's designed to protect you. So all in all, we want you to know that physical therapists are here, pelvic health physical therapists are here to help address fertility needs and factors that affect fertility, and we do so by doing exercise, soft tissue mobilization, and helping manage and decrease stress. And so come see us. We'd love to see you.
So until next time, ladies, and anyone else, stay balanced.